Hey everybody, it's Dana Coretta Stein with Peaceful Living. I wanted to jump on and just give everybody a little bit more information about how to use EMDR to treat coronavirus anxiety. I know the question has come up a bunch about which protocol to use and what scripts to use. So the information that we are getting from EMDR and from the Humanitarian Assistance Program, which is HAP, is that we should be using EMD. I know some people have asked about RTEP, which is the Recent Traumatic Events Protocol, but from everything that we're hearing, EMD is the way to go. So EMD is Eye Movement Desensitization without the reprocessing. So it's basically restricted processing. So how that works is that you always want to make sure with any client, old or new, is that you're getting history taking. So how is the coronavirus anxiety impacting their day-to-day functioning? And then you want to make sure that we do resourcing, right? We want to make sure that they have, stuff that helps them feel good and feel safe. So we're going to, ask if they can do breath work, anything that's grounding. So breath work, a calm place, a container. Those are just a couple of examples, but, everybody knows their different calming skills. And then we're going to set up a target assessment. So what that looks like is that you're going to get, you to ask them about the situation that they want to work on, which is usually in this instance, the COVID anxiety, and what image represents the worst part about that right now. For clients who aren't visual, maybe it's not an image, maybe it's a sensation, maybe it's, a sound. Everybody's different. Just lean into your client, what's best, and then get the negative belief. So when you think of that image that represents the worst part about this situation, what belief do you have about yourself right now? And, maybe it's I'm not safe or I'm in danger. Some of that's not totally irrational, right? But you want to ask them what the negative belief is about themselves, and then get the PC, the positive cognition. So when you think about this image, what do you wish you could think about yourself right now, even if it's not totally true yet? And then you get the VOC, the validity of the cognition on a scale from 1 to 7. How much do you believe that PC? And then you're going to get the SUD, the subjective units of disturbance. I always forget what the S means. I screw it up, but just get the SUD. So on a scale from 0 to 10, how disturbing does that image come to you right now? And then you're going to go into the bilateral. So for every client, you know what form of bilateral works best for them. You can do the corners of the room if you want to do the eye movements. For virtual EMDR, a lot of things that we're hearing is that the butterfly hug is best. So that's going to be just crossing your fingers, hooking your thumbs and crossing your hands. And then you tap. You want to do medium speed when we're doing EMD. We don't want to go too fast because then we can open up other memory networks, and we don't want to do that because we're trying to keep the processing very restricted right now. And then we're going to, so you do that. And then for the EMD, you're going to continuously bring them back to target after each set of bilateral. So every time you do a set of eye movements or a butterfly hug, then say, okay, now when you think of the image, scale from 0 to 10, how disturbing does it come to you now? Notice that. And then do another set of bilateral. Now on a scale from 0 to 10, how disturbing does it come to you right now? Well, now it's a 6. Okay, now what's the worst part? Notice that. And you're going to keep going back to target each time, getting the SUD each time. I know it's different from what we do with the standard protocol, which is usually 2 positive or neutral and then back to target. So with this, it's different. We're not doing any reprocessing. We're keeping everything really tight. We're narrowing the lens and we're keeping it restricted. And then you just go down. You're not going to do a body scan here because we don't want to get our clients into their body. We don't want to activate any old traumas right now. We're trying to stay present, oriented to present safety, oriented to, present calming, grounding as much as we can. So it's basically how the EMD works. If anybody has any questions or they need extra resources, please remember to check our regional network website, which is westchesteremdr.com. If you have any other questions, please don't hesitate to reach out. If I don't know the answer, I'll try to find it for you. And hopefully, I hope everybody is staying happy and healthy as much as they can, not going too crazy in their homes. I know I'm in my living room right now. Thankfully, it's quiet because the baby's sleeping. But if anyone needs anything, please let me know. And I hope to speak with you soon. Bye.